Good morning friends, welcome on my channel Charming Science. My name is Aniket Misra and today I will be guiding you through the anatomy of the fibula. So this lecture is designed especially for the medical student, ensuring you gain strong understanding of this vital yet often overlooked bone. The fibula is often considered as the unsung hero of the lower limb. That means it's play a very crucial role in the ankle stability and the muscle attachments. While it's contribute minimally to weight bearing, its anatomical relevance in clinical practice is significant. Throughout this presentation, I will walk you through the structure, function and the clinical relevance of the fibula, along with important landmarks you need to know for your exams and clinical practice. So come now, let's begin by first understanding of the location and the positions of the fibula. So as we can see, the fibula is situated onto the lateral side of the body. So the tibia, it is situated near the medial side, and the fibula, this one is the red one, it is situated lateral side of the leg. It runs parallel to the tibia. It extends from the inferior surface of the lateral condyle. This is the surface of the lateral condyle of the tibia. So it starts from extending from the inferior surface of the lateral condyle of the tibia above and come down toward till at the lateral malleolus of the ankle. Here is the position where the lateral malleolus has been formed. Unlike the tibia, the fibula is thinner and plays a minor role in weight bearing. Its primary function is to provide attachment for various muscles and contribute significantly to ankle stability. Understanding its precise position is crucial for identifying fractures, nerve injuries, surgical approaches in clinical practices. Starting from the proximal end, when we are going to look into the anatomical structure or anatomical features, we will see that starting from the, let me make it a blue, yes, so it's from the starting end or starting from the proximal end, we have the head. This is the structure. There are the two bones which are present, the fibula, the anterior surface of the fibula, this one, and the second one is the posterior surface of the fibula. So we don't need to confuse regarding this. This is just an anatomical feature in this. So the head of the fibula is situated at the proximal end of the bone and it articulates with the lateral condyle of the tibia. It's make a very significant or the slightly joint between the lateral condyle of the tibia. Just below, this is the neck of the fibula. As we come down, we will find that there is having a neck of the fibula. After having the neck, there is an area of a clinical importance due to its close relation to the common peroneal nerve, which is vulnerable to injury. The shaft of the fibula having the three border. So as we come below, we will find that there is having an anterior border, the medial border and the posterior border, and there's having a prominent landmark of interosseous crest, which is only visible in the anterior border or the anterior surface. The anterior border, it generally provide attachment for the extensor muscles, and the interosseous border connect the interosseous membrane. Posterior border provide attachment for the flexor muscles group. Finally, at the distal end, we have the lateral malleolus, a bony prominence structures. So at the lateral distal end, we having a lateral malleolus, a bony prominence that stabilizes the ankle joint by articulating with the talus. This area is often involved in the ankle injury, especially fractures. Let's come. We will see the specifically the landmarks of the fibula. Okay, so first we have to see that this one is the first image or the image A. It's from the behind, or we say it's from the posterior sides. The image B, it's from the upper side or the proximal end. The image C is from the above. Image D, it is the distal end, and E is the distal end from the below, or from the below view. Okay, so in the first figure, the proximal end, we will find that there is having a first structure, that is the apex of head. So the apex of head is the top structures or the prominent structure which is present on the fibula. There is having the articular facet for the, there is having the second structure which we can see in the proximal end. When we see the proximal end of the fibula, we will find there is having a articular facet. Articular facet joint, or its joint, it is a place where the superior tibiofibular joint will take place. Or we say that this is the position where the proximal tibiofibular joint will form. There is having the third one. This is the structure for the articular facet for the lateral malleolus. So here is the structure in the E figure, or in the distal end from below. We will find there is having the number 3, that is used for the articular facet for the lateral malleolus. So when the lateral malleolus is going to the form between the fibula and the talus, this is the place where the talus or the lateral malleolus joint or the articular facet will present. The fourth one is the head of fibula in the image A. Fifth one is the inferior surface of tibia. Fifth surface, here is in the E structure or the E figure, we having an inferior surface of the tibia that form the ankle joint with the talus. The sixth one in the D image, it's the inferior tibiofibular joint. So as in the number 2, as it forms the superior tibiofibular joint, number 6 one is the place for the inferior tibiofibular joint. The number 7 in the image E, it's a lateral articular surfaces of medial malleolus for the ankle joint, or we say the point where the medial malleolus will lie. The ninth one is the part of the fibula. It forms the lateral malleolus of the fibula. The eighth one, I forget the eighth one. So the eighth one is present lateral condyle of tibia. So it's a part of the tibia which lie toward the lateral side. The 10th one, the malleolar fossa. So there is the malleolar fossa is generally a structure from where the muscles or the nerve will pass. Okay. So the malleolar fossa is a small depressed area located on the medial surface and provide attachment for the posterior talofibular ligaments and the inferior transverse talofibular ligaments. The medial malleolus, this is the number 11, which is present in the image D. This is the part of the medial malleolus. And the 12th one, here is the structure in the image A. It's a superior tibiofibular joint. So now we will especially see the fibula. So it's an image of the left fibula with the proximal ends. So the first image is from the anterior view. The second image, the image B, is the posterior one. The image C is from the medial side and image D is for the lateral side. So as we see that it's the anterior border. First one is the anterior border, and as we've learned that the anterior border is going to give their attachments on the extensor muscles or for the extensor muscles. The second one is the apex, as we can see in all the figures, is the apex of the fibula or the topmost part of the fibula. The third one is the articular facet for the articular facet on the upper surfaces. So it's from a joint of the proximal tibiofibular joint. The fourth one is the complete structures of the head or the main structure, to which we say it's a head. The fifth one is the interosseous border. We can only see it on the medial surface or little slightly bit on the anterior surface. So the interosseous border, it connects the interosseous membrane. The sixth one is the lateral surfaces. We can see clearly it on the lateral side. Seventh one is the medial crust. We'll see it in the posterior surfaces and along with the medial surface. The eighth one is the medial surface. Ninth one is the neck of the fibula. 10th is the posterior border, and the 11th one is the posterior surfaces of the fibula. So now we are going to see the attachments for the on the left fibula on the proximal end. So as usual, or in the previous slide, we have seen that the image A1 is the anterior one, B is the posterior one, C is on the medial side, and D1 is the lateral side. In this figure we can see there is having some few lines that is present. That one is the blue line, that's called the epiphyseal line. Green line is a capsular line or the capsule that's formed between the joints. It is having a some lines of pale green lines. If there is having present in it, then they are for the ligaments attachments. Okay, so first at the tip of the fibula we are having the attachment for the biceps femoris. So generally the biceps femoris originate from the long head, originate from the ischial tuberosity, and the short head is going to originate from the linea aspera of the femur, and they are going to insert at the head of the fibula. Their nerve supply is from the tibial nerve, that is the L5, S1 and S2. There is having the another muscle, that is the extensor digitorum longus. The extensor digitorum longus, we can see it on the medial surfaces or in the anterior surface. It's having a long muscles attachment on the anterior surfaces. So the extensor digitorum longus is going to originate from the lateral condyle of tibia, superior 3/4 of fibula, and from the interosseous membrane. It goes below and insert at the middle and distal phalanges of lateral foretoes, and it gets their supply from the deep peroneal nerve. The third one is the extensor hallucis longus. Here is the extensor hallucis longus. The number 3 muscles is present. So extensor hallucis longus is going to originate from the middle third of the fibula or some part from the interosseous membrane and insert at the distal phalanx of grade 2. Supply same deep peroneal nerve. There is having the fourth one is the collateral ligament. So there is having the in the head or the top of the fibula, we'll find there is having the number 4 that is showing the fibular collateral ligament. So the fibular collateral ligament is it's a ligament that is originate from the lateral epicondyle of femur and inside at the head of fibula. Fifth one is the flexor hallucis longus. So here is the structure. The fifth one in the lateral side or in the posterior view, we can see we are having a fifth one that is the flexor hallucis longus. It's originate from the inferior two-third of the posterior fibula and some part from the interosseous membrane. It's also inserted at the distal phalanx of grade 2, supplied by tibial nerve, not the common peroneal nerve. It's by the tibial nerve. The sixth one is the interosseous membrane. So here is the structure that is going to, this one is the long structure that is going to called the interosseous membrane. So interosseous membrane is going to originate from the between tibia and the fibula. It's not having any insertion because it's a membrane, not a muscles. Okay. So seventh one is the peroneus brevis. Here is the anterior surface. We will we can see that this is the seventh one is the peroneus brevis. So it's also going to originate from the inferior two-third of the fibula and insert at the tuberosity of the fifth metatarsals. The eighth one is the peroneus longus. In the lateral side or in the lateral view, we can see that this is the place for the attachment, or in the anterior one, this is a broad area or the broad area of the muscles attachment, that is the peroneus longus. So it's originate from the head and superior two-third of the lateral fibula and is going to insert at the base of first metatarsal and the medial cuneiform, supplied by the superficial peroneal nerve. The ninth one is the soleus. Soleus is we can see only on the posterior surfaces, slightly on the lateral surfaces, but mainly on the posterior surfaces. So the soleus muscles, it's originate from the head and the posterior surface of the fibula and insert at the posterior surface of the calcaneus bone, supplied by the tibial nerve. The last one is the 10th is the tibialis posterior. So tibialis posterior we generally see on the medial surfaces, medial surface of fibula. So tibialis posterior is going to originate from the interosseous membrane, posterior tibia and some parts of the fibula, going to insert on the navicular cuneiform, cuboid and the base of 2 to 4th metatarsals, supplied by the tibial nerve. Now we will look on the landmark on the fibula at the distal end. So E1 is the anterior, F is the posterior, J is the medial and H is the lateral sides of the fibula. So when we start there having the, we will see that the first one is the anterior border. The second one we will see here in the medial side of the image, we will find the articular surface of the lateral malleolus. The third one is the groove for the peroneus muscles. In the posterior surface, we will find that this is the groove for the peroneus muscles. Fourth one is the interosseous border. Interosseous border we will find in the anterior surfaces, and along with that we will find it on the medial surfaces. Fifth one is the lateral malleolus. So we will see it the distal and completely distal end. We will find that this is the distal end of the fibula. So this is the structure of the lateral malleolus. Lateral surfaces. Sixth one is the lateral surfaces. So it's clearly visible in the H structure, that is the complete for the lateral surfaces, but there are the some part because it's a thin or slim bone, so there's some part which we can see on the anterior and the posterior surfaces. Seventh one is the malleolar fossa. As we talk about that, malleolar fossa is the structure which provide the attachments for the ligament of the ankle, provide that ligaments attachment for the ankle. The eighth one is the medial crest. Medial crest is a prominent landmark present on the fibula. It's not originates from the or the starts from the distal end, but it starts from the between the shaft, around the 1/3 of the shaft, and come below and toward the distal end. Ninth one is the medial surfaces. 10th one is the posterior surface. 10th one is the posterior border, and the 11th one is the posterior surfaces. 12th one is the surface for the interosseous ligament. Here is the structure on the medial side, or the G structure. We have the surface for the interosseous ligament, and the 13th one is the triangular subcutaneous area that is present on the lateral surface of the or the lateral side of the fibula. So now we will look into the ligaments or the attachment muscles attachment on the distal side of the fibula. As we get know there, this is the EFGH, anterior, posterior, medial, and the lateral. So the first structure is the anterior talofibular ligaments. At the below, we see that the anterior, that means it's come in the anterior image or the anterior surface of the fibula. Talofibular, it's mean bonding from the, it's a ligament that is forming the relation between the talus and the fibula. So the anterior talofibular ligament is the ligament that originates from the lateral malleolus of the fibula and insert on the neck of the talus. Its function is to provide lateral ankle stability and prevent excessive inversion. There is another one, the second one is the second one is the calcaneofibular ligament. So the calcaneofibular ligament also are going to originate from the lateral malleolus of fibula and provide or the attach at the lateral surface of the calcaneus, and it prevent excessive inversion of the foot. The third one is the extensor digitorum longus. As we said, here is having its surfaces. So the extensor digitorum longus is going to originate from the lateral condyle of the tibia or the superior 3/4 of the fibula and from the interosseous membrane, and going to insert at the middle and distal phalanx of the lateral four toes. Get their supplies from the deep peroneal nerve. After that, there is having the extensor hallucis longus. Near to it, on the anterior surface, there is having a muscle extensor hallucis longus. It's a muscle that is going to originate from the middle third of the fibula and the interosseous membrane, get inserted on the distal phalanx of the great toe, supplied by the deep peroneal nerve. After that, we having the flexor hallucis longus. This is the structure we can see on the posterior surfaces. So the flexor hallucis longus is going to originate from the inferior 2/3 of the posterior fibula and the interosseous membrane, and going to insert on the distal phalanx of great toe, supplied by the tibial nerve. They are having the sixth one is the interosseous ligament. So this is the structure in the third one or the medial one structure. We can see that it's the interosseous ligament that is present between the tibia and the fibula. Their function is to hold tibia and fibula together at the distal tibiofibular joints. There is having the interosseous membrane. The seventh one is the interosseous membrane that's running between the here in the medial surfaces. So the interosseous membrane is the connection or the present between the tibia and the fibula. It's a fibrous connection that joins the two bones and provide a structural and functional support to serve as a muscle attachments of the tibia. There is having the muscle peroneus brevis. The eighth one is the peroneus brevis. We can see it on the lateral surfaces and slightly on the anterior surface. Here we will see. So the peroneus brevis is the muscle that is going to originate at the inferior two-thirds of the lateral fibula and insert at the tuberosity of the fifth metatarsal, supplied by the superficial peroneal nerve. Another muscle, peroneus tertius. Peroneus tertius is the muscle is present on the anterior surface. So the peroneus tertius is the muscle originate from the distal one-third of the anterior fibula and insert at the base of the fifth metatarsals, supplied by the deep peroneal nerve. The 10th one is the posterior talofibular ligaments. Here is the structure. So the posterior talofibular ligament is the ligament that starts from the posterior aspect of the lateral malleolus and insert or the attach at the posterior process of the talus, and it prevent the posterior displacement of the talus. There is having the another ligament, that is the posterior tibiofibular ligament. Here is in the posterior image we can see it. So the posterior tibiofibular ligament is start from the posterior tibia and at the posterior fibula, and it maintains stability of the distal tibiofibular joints. The last one is the tibialis posterior muscles. Here is the structure for it. So the tibialis posterior muscle is going to originate from the interosseous membrane and the posterior tibia and fibula. It's provide their insertion at the navicular cuneiform cuboid and the base of the second to fourth metatarsals and get their supply from the tibial nerve. When we look toward the nerve supply of the fibula, so the primary nerve supply of the fibula is by the common peroneal nerves that's wrap around the neck of the fibula. As we say that it's going to wrap around the neck of the fibula, and also with the deep peroneal nerve that supplies the anterior compartment of the muscles. There's having the another nerve, the superficial peroneal nerve that supplies the lateral compartment of the muscles, and tibial nerve that contribute to the some posterior muscle attached to the fibula. There is having a clinical relevance of the fibula that's in the common peroneal nerve injury. So whenever we having or the person is having a fracture of the neck of the fibula, it's generally or maximally we say that it's injured our peroneal nerve, and due to that nerve or the injury to the peroneal nerve, there is having a foot drop, and in the foot drop condition we lost the dorsiflexion and the eversion. The another one is the superficial peroneal nerve damage. If the superficial peroneal nerve damage, or we in the accident, if there is having any injury at the lateral side of the fibula and peroneal nerve, superficial peroneal nerve will damage, then we lost the foot eversion, and along with that the sensory loss will also occur. Deep peroneal nerve damage, if the deep peroneal nerve damage, as we seen that it supplies the anterior compartment of the muscles, so if the deep peroneal nerve is damaged, though the loss of toe extension and sensory loss in the first web space will be done. So this is the image where the nerve pathways around the fibula, that is the common peroneal nerve, deep peroneal nerve and the superficial peroneal nerve, and in the foot drop the patient will show the steppage gait. So if the person is not able to dorsiflex his ankle, so while walking he is not able to clear the ground surfaces while walking. So for clearing the ground surfaces he will do the steppage gait. In the steppage gait he will do the excessive knee flexion or the excessive hip flexion. So the foot or the ankle gets clear from the ground and he can keep away or keep in front for walking. Blood supply of the fibula. So they having a major supply or the main artery supply from the fibular artery. There is having a nutrient artery that enters the shaft through the nutrient foramen. Contribution from the anterior tibial artery and the posterior tibial artery. There is having the venous drainage that is done by the fibular vein or the posterior tibial veins. If there is having a clinical relevance, we talk about the clinical relevance. So if there is having the fibular fracture, it may disrupt the blood supply. Whenever there is having a fibular fracture, it may disrupt the blood supply, leading to non-union or delayed union. Sometimes if the fracture is going to occur at the distal end of the fibula, there is having not the maximum chances, but there is having a lot of chances that the avascular necrosis will be done, because the distal end of the fibula will get their supply from the collateral circulations. There is not having any direct supplies. They get their supplies from the collateral circulation. So if at the distal end there is having an injury, so it can lead to avascular necrosis. And fibula graft are commonly used in orthopedic and reconstructive surgeries. Example, that is for the mandibular reconstructions. So that's all for the anatomy of the fibula. So if you like our lecture, please like, share and subscribe our channel so you get notification every time and increase your knowledge day by day. Thanks a lot for joining us. Thank you.